Okay, everybody, welcome to our masterclass for vertigo sufferers. Super excited to be giving this class. We've been doing these masterclasses for about 4 years now. We rotate the topics between back pain and sciatica, knee pain, neck and shoulder pain, and for the first time ever, we are giving away valuable information for those out there suffering from vertigo, otherwise known as debilitating dizziness, room spinning, things like that. And the reason we do this is because a lot of people think they need to resort to pills, procedures, emergency room visits, scary testing to get rid of their vertigo or treat it, and that's actually not true. So we're going to be going over a lot of that today, okay? So what are you going to learn exactly? We're definitely going to go over why vertigo is such a problem. And for those, some people know this, some people don't, but vertigo is not actually a diagnosis in and of itself. It's a collection of symptoms, often debilitating symptoms that people experience for various reasons that we are going to go over. So like anything, you got to get the right cause to get the right treatment. So we're going to go through a lot of that. For some of you here, everyone's going to walk away with valuable information, and no matter where you are in the spectrum of vertigo suffering, some of you have had it in the past and you want to learn information so you can prevent it. Some of you are currently suffering. Some of you have kind of mild symptoms. No matter where you are going to walk away with tips and tricks of things you can do immediately as soon as we finish this class to start to improve various things. Some of those things are going to work for you just fine. You're going to notice immediate improvement. But some of you are going to realize, you're in a different spot and you need specialist treatment, or you need a class, you need something like that. So if that's you, we're going to go over at the end some ways for you to get help. And if you're local, you can get help from us. We've got some special offers for people who signed up for this class tonight. So I'm excited to tell you what those are, and we'll go over them at the end. But definitely stay to the end no matter what, because if you've got questions, we'll have time to answer them. And like I said, you're going to learn a lot, and you'll learn a lot from other people asking questions as well. So let's get into it. A little bit about us real quick. We are located here in Portsmouth, New Hampshire. We specialize in folks over the age of 40, although we don't discriminate. We sometimes let people in who are younger than 40, especially those suffering from debilitating vertigo. But our thing here is we want to keep you active, healthy, and mobile so that ultimately you can spend your time, your golden years, any years, doing activities you love instead of multiple doctor's appointments or being on medication or going through procedures and surgery. We empower you through movement because, as you'll learn, vertigo included, movement, specialized movement, of course, prescriptive movement, resolves about 80 to 90% of all problems that have to do with your body, musculoskeletal system, vertigo included. So that's what we specialize in here. We are vertigo specialists, not myself actually. You're going to meet Dr. Holly shortly. She is our vertigo specialist. She's amazing. We are Pilates experts. We love to incorporate core strengthening to just about everything we do, even vertigo. A lot of people come to us because we offer a specialized service, people who have kind of failed or just not done well with what we call regular traditional type of physical therapy. Sometimes that's a little too cookie cutter for people suffering from vertigo. You really need a vertigo specialist to help you with vertigo symptoms. Sometimes you need a back pain specialist to help with your back pain or sciatica. But we definitely don't just treat what you have going on. We diagnose you, which is going to be a huge part of what you're going to learn tonight. The diagnosis matters. You have to get that right. And not everyone gets it right. Not all tests are designed to get your diagnosis right. So a little bit about me, other than the fact that I don't know how to use PowerPoint or Zoom, apparently. I've been doing this a long time. I've been a physical therapist by training for a little over 20 years. I think this slide is old because I'm going on 22. Went to Northeastern, Simmons, and Boston. I've got some certifications in dry needling. This mechanical diagnosis and treatment is what makes us a corrective movement specialist. So that's just a little bit about myself. But the star of tonight's show is really Dr. Holly. She is one of I'd say the leading vertigo specialist on the Seacoast. She has helped so many of our clients. That's why I could not wait to put this masterclass on. That's why I've never been able to really do a masterclass for vertigo before, because we never were able to offer this service to folks before. But she's amazing. She also specializes in concussions. She's had some of the best training in the United States, and she too specializes in the same corrective movement specialty that I have, as well as dry needling. So we kind of, we've got some fancy letters and certifications under our belt. So that's one reason to maybe listen to us. But to get into why you're really here is let's talk about vertigo. Okay, so vertigo is a big problem. I think you guys know that. That's why there's so many of you signed up tonight. About 200,000 people a year suffer from it. Almost half of US adults experience vertigo at least once in their lifetime. And if you haven't yet experienced a debilitating episode of vertigo, it's terrible. You're dizzy. I've heard people talk about like not being able to stand up. They have to crawl, to the door, crawl to the phone. It's literally quite debilitating. Room is spinning. It's scary because you don't know what's going on. Are you having a stroke? Like what's going on? So it's not fun, and it is a big problem. And we'll get into it, because it's scary and because it's kind of confusing and it's often misdiagnosed, less than 50% of people who do experience vertigo actually get treatment, not only any treatment, but the right type of treatment to actually solve their problem. It definitely affects older adults, and it affects a lot of people in this region in the Northeast, okay? It's also an expensive and a costly problem. Because of the debilitating symptoms I just described, a lot of people do go to the ER first. And it's not really a good idea to go to the ER. I just wrote an article about this, actually, about $10 billion a year in ER visits. But the sad truth is almost half of the diagnosis you get in the ER are not correct for your vertigo. They end up going to the doctor changes the diagnosis. But it's also costly because it's debilitating. People call out of work, they can't go to work. Some people have to change their jobs because of this. They have to stop their favorite activities. And for those folks that are a little bit older, your risk for falling just gradually increases as you get older. Never mind, you add dizziness and incoordination and poor balance to the mix, you're definitely at a greater risk for falling. And quite a few falls result in injuries, sometimes injuries like a broken hip that require surgery. So it's costly for monetary reasons as well as, personal reasons as well. Okay, so it's a big problem. That's why we're here. Common symptoms of vertigo. So vertigo is a collection of symptoms, as I said, and you could have any or all of these, but definitely dizziness is sort of like the big one. Room spinning, you might feel nauseous. You definitely puts you at risk for losing your balance and falling. You might even get like ringing in your ears and hearing changes. Sometimes you can get. Your vision can be affected. All of these things that you can read on this slide are things that if you've ever had any of these, and then you can see over on the right, there's some like social things that start to happen because you don't feel good. You have to cancel plans with your friends. Can't quite explain what's going on. They don't understand what's going on. It can be depressing as well. So if you're feeling any of these things on here, don't feel alone, because this is what happens when you've got vertigo. These are all very common things to experience if you've suffered from this or you're suffering from it now. Now, here's the other thing. So you think vertigo, a lot of people take medication, and medication can mask the symptoms you have, but it doesn't actually solve your vertigo problem. If any of you on here have been on medication for a while and you still have vertigo, you know exactly what I'm talking about. So the good news is that vertigo can actually be treated naturally. And these are just a few of the signs that indicate you can treat your vertigo naturally. It comes and goes. I talked to a lot of you on the phone before this class. You've told me that you recently suffered from a vertigo attack like a month ago. It hasn't come back, but you're kind of dancing on the surface. You'll have good days and bad days, okay? Those are super common signs that your vertigo can be treated naturally, which we're going to get into later. In other words, not with medication. If your vertigo changes when you move around, it seems to be positional, things like that, like when you go from the floor to get up, that's a sign that your vertigo could be treated naturally. Comes out of nowhere. Everything that you kind of see on this slide, if this is how you experience your vertigo, there's a really good chance it can be treated naturally, which is a good thing, and that's why we're here, right? Because we don't want to be on medication, and we want to avoid procedures that quite often just don't work. All right, so now I'm going to hand it over to Dr. Holly, because she is the expert in this topic. She's going to go through just some anatomy to help you kind of get an understanding of what the heck we're talking about, and I'll let her take it from there. And just let me know when you want me to switch the slide, Holly, okay?
All right, so I'm sure Carrie will catch me here, but I'm going to do my best to make this make sense, but also keep it kind of simple because our vestibular system is pretty tricky and complex here. But to start, we've got two of them, right? So we have one in each ear. And as you can see in this picture here, we've got three circles on the left side there. And then that brown part in the middle there, that's where all of our crystals sit. So, oh, yeah, we've got a little bit better of a picture of it there too. So this kind of relates more to that like BPPV, the crystals, like people who have heard of that, that you kind of get the episodes of it. So what happens when we look at this picture here? So when our heads are good, we're not feeling any of that vertigo dizziness, that little spot of crystals there in that brown spot in the middle of the picture there, everything sits in there. We move our head and your ears tell your brain, yep, we're moving, we're all in check here. And then what happens when you're struck with the vertigo, we have some sort of change, whether it be more or less of the system here, we start to get changes. It tends to happen one ear at a time. So one ear thinks that it's moving and the other ear has no idea what's going on because those little crystals, they get dislodged. They end up in that circle. If you can see the wording there, it says that little semicircular canal. So our goal is to get them out of there, put them back into that nice little brown spot there and get them all back into the nest. And then that leads to you not having dizziness. I know that's a little bit of a funky thing to think about, but really our ideal goal is getting everything back into the spot that it needs to be.
So Holly, what you're saying is this little crystal in the middle gets dislodged and moves into these canals over here. And when it does that, it's a big no-no. And then the ears don't really work the way they're supposed to, and it causes dizziness. Is that what you're saying?
Exactly. And our goal is to get them back where they need to be.
So the point is you can get them back to where they need to be.
Exactly.
All right. I'm learning too, guys. See?
All right. So if we move on to the next slide there, we'll get into some of the different types of vertigo.
Oh, sorry. Oh no.
So I
this
broke
one, right?
it in. Yeah. Can you move it on to the next slide there, Carrie?
Oh, sure. Sorry.
Oh, good. So I broke it into three parts. We've got the vestibular, and we'll talk more about this in the next slides. We've got what we call a vestibular hypofunction. We've got a hyperfunction. That's when we have changes to the inner ear itself. But vertigo isn't solely caused by that. It can also be called cervicogenic dizziness, and that is when we have neck problems that actually give us vertigo dizziness, very similar symptoms, but caused by a totally different area in our body. And then that last category in there, that non-peripheral vertigo, otherwise known as central nervous system, that's when it's something caused by the brain. That's a very small percentage, so only about 5 to 10%. But it's important to be able to screen that out and make sure that we know exactly where your vertigo and dizziness is coming from so that we can match that with the proper treatment for you. And we can go on to the next one there. So first one is that vestibular hyperfunction. The more common name that you've probably heard is that BPPV, the benign paroxysmal positional vertigo. It's a mouthful, but that's essentially what we were talking about before, is when those crystals get bumped into a spot in the inner ear that they're not supposed to, when those are moving around when they shouldn't, that's when we end up with those brief but very strong and debilitating episodes of dizziness that'll often come with nausea, spinning, all kinds of things. But then when you tend to stop that movement, it goes away. That can happen when you're getting out of bed, when you turn your head really quick, or say you bend over to pick something up with that. And then the other side of that, so this also happens in the inner ear, that what we call that hypofunction tends to be called more, if you've heard of Meniere's disease or vestibular neuritis. With this, we see a decreased function. So our inner ear isn't working as well as it should be. And when there's essentially a lag in the system, we end up with dizziness. You can get it in both ears. For the most part, people tend to notice it when they have it in one ear, because actually, if you have it in both ears, you won't be dizzy. You'll just find that you fall a lot. So those people tend to more so be the people that are scared of falling. You can still get that dizziness and vertigo. They often tend to have more headaches and brain fog. And it's just difficult to follow your daily tasks. It makes your workload a whole lot more challenging. You just have a hard time concentrating. Following conversations can be really difficult. And a lot of the times that ends up leading to that social isolation. Oh, goodness, isolation, social isolation, and then just difficulty with a lot of your brain tasks in there as well. And the next one we'll move on to. So we actually moved out of that inner ear and into the neck here. So that cervicogenic dizziness, that tends to happen when we have an untreated neck injury. And that over time leads to dizziness and vertigo. What I always like to make sure that people understand is you don't actually have to have neck pain for this to be the cause. Oftentimes, people will have neck pain associated with it, but we tend to see more things like light sensitivity. They're lightheaded. Maybe some vision changes have happened, tends to be associated with a lot of headaches. This is where things get tricky because it's oftentimes passed off as the wrong diagnosis. And we have to make sure that we get at that mechanical piece of the neck. And, as you can see in the slide here, it can't necessarily be diagnosed with an imaging. Maybe you've had an MRI or an X-ray and it looked clear and they told you nothing was going on there, but there tends to be a lot more under the surface that we have to take a look at.
Awesome. Thank you, Holly. So basically, what Holly is trying to say, if you didn't catch it, is vertigo, again, there's 4 kind of categories. There's the peripheral vertigo, which has 2 types, the hyper and the hypo. They both happen in your inner ear, okay? And a lot of people get referred to ears, nose, and throat specialists and even neurologists, right? When they go to the ER, they get this diagnosis, they go to a specialist, they often have to wait a very long time. Now, the thing is, you don't have to go to one of those people, because guess what a neurologist and an ENT is not going to figure out for you? They're not going to catch the cervicogenic dizziness because they're not trained in that, really. They're trained in ears, nose, and throat is trained for your inner ear. Neurologist is going to be ruling in or out those things that have to do with your brain. So if you go to someone that knows how to treat and figure out and diagnose all of it, with the exception of that that central vertigo, which that's something that essentially, if it's not one of those first 3 that I mentioned, we sort of know it's that. And then like someone like Dr. Holly, who is a vertigo specialist, will refer you to the correct person, kind of speeds it up for you, really, rather than, I know so many of you on this class tonight, that's literally what's happening to you. ER, this specialist, that specialist, that specialist. Everyone just sort of kind of pigeonholing you into what they know, and especially it's not their fault, it's just what they know, but you're just being sent to the wrong place. So you really want to start with a central command, if you will, which literally Dr. Holly is, because she understands that this is primarily 80% of the time a movement-based problem, aka literally the crystals are moving in your ears. It can be if you had like whiplash or a concussion that never got treated properly, you can end up with underlying stuff in your neck, your upper neck, that causes these symptoms of vertigo. So as this slide kind of indicates, that's a big problem, right? So this was a study that we found 86% of vertigo sufferers suffering from that first one she talked about, that BPPV, they actually went and sought medical consultation because they were, debilitated, not doing things they love to do. But out of that whole group, only 8% actually received the correct type of treatment. So it's a big problem. Even if you kind of get the right diagnosis, then people just aren't trained. They don't know how to treat it properly. So it's a combination of the poor ability to diagnose, and if you get the diagnosis, there's just not enough qualified trained specialists to really tease this stuff out. Because sometimes I know there's people that really know BPPV, but if it's not that, they don't know what to do. There's that whole hypo vestibular dysfunction that Dr. Holly was talking about that has to be treated a whole different way. So it's really critical that you understand how to diagnose it, how to rule things in or out, and then of course how to treat it. But that's why a lot of people don't get the right vertigo treatment, because there's just a lack of knowledge and training out there. The other reason people don't get treatment is because they're scared of it, right? I mean, that episode you get is so debilitating. The last thing you want is to get it again. And when you get vertigo treatment and any kind of treatment, really, the same thing for backs and knees, we and any other musculoskeletal problem, we often have to trigger or bring out your symptoms to figure out what's going on. And when it comes to vertigo, people are deathly afraid of that. So this is another reason people avoid treatment. But if you're suffering, we encourage, as long as you're going to the right person and the right specialist, the right specialist is going to have a plan for you, and they're going to talk you through all these things. They're going to, yes, symptoms might get triggered, but there's going to be a plan. They'll walk you through it. They'll follow up with you, and you won't just be left hanging. If that happens, I'm sorry for you, and you've kind of not been treated correctly. But it is going to happen. But if you're under the care of a proper specialist, these things are going to be managed. But this is a big reason that deters people from treatment. I've had a lot of conversations with some of you on here and people in the past about this very thing. So facts about vertigo. We've kind of gotten into this already, but vertigo can be treated anytime. It can be treated right when you get it. It can even be treated, later, especially if you're still having symptoms. There are specialized tests that we use, Dr. Holly uses, to determine what's going on and figure these things out. We talked about this, 80% of vertigo is what we call that peripheral category. So remember, 3 out of those 4 categories that Dr. Holly talked to you about, those are peripheral. They can be treated by a specialist physical therapist like Holly, someone who's trained properly. That central vertigo is a different animal, but it's only about 5 to 10% of all vertigo cases. One of the ways that we help people with vertigo is we don't just work on that inner ear and that's it. We want to strengthen and get all 3 of your balance systems working together. So your visual system, your inner ear vestibular system, and your musculoskeletal system, which has to do with core strength, your feet, strength of your legs, being able to literally hold your balance. And then at the end of the day, when you get the right treatment, you feel more confident, because right now a lot of you are walking around, avoiding certain things. You're fearful of falling. I've talked to people where they're in the car and they're just like, I don't drive very far because I'm so afraid that if I turn too quickly or I turn the wrong way, I'm going to get that episode. I'm going to get into an accident. So they've kind of stopped driving. They're losing their independence because they have to shorten their drives. People, have had to call out of work, and it's cost them, problems at work and things like that. So, and it makes you lose confidence in yourself. It's like, oh my gosh, do I have to live my life like this? The answer is no. But the treatment will get you feeling more confident and being able to manage and control your own systems when you have more awareness of what's going on, and sort of tools to kind of fix it yourself if you can. So peripheral vertigo, you've heard this word. Holly talked about it. This is not the cervicogenic one, where the one that comes from your neck. Peripheral vertigo is when there is a disconnect between what's going on in your inner ear, your vestibular system, and your brain. So they've kind of lost contact, if you will. If they can't talk to each other, it really throws off that the vestibular system can't work. Your vestibular system is what kind of helps you figure out where you are in space. It talks to your brain, so your brain can know. If they aren't talking, things go haywire, and that's why you feel things spinning, and that's what happens. Okay, they've lost connection. The connection has to be reestablished. So that's kind of what we do, and how we do it is, remember we said it can be treated naturally. And Holly, I think when you guys have questions at the end, she can chime in with some of the more specific things she does, because she can speak to this a little bit more. But she talked about those crystals moving around. Well, you literally have to get them to get out of the canals and back to where they're supposed to be. That's done with movement. Just like movement knocks them out of place, the correct movement can knock them back into place. And then, so that's an example of how we treat it naturally. The hypo function, which is more that connection between your brain and inner ear, but not necessarily because of the crystals, that requires a little bit more, not complicated, but a little bit different type of training to get all those systems working together, because you have to retrain other systems to help the brain out for what the vestibular system's not doing. So those are just some examples, but it's all movement based, it's training based, and it's natural. It doesn't require medication. So some other things besides what we do here in the office that you guys can do completely on your own is get your vitamin D levels checked. There's a reason why vertigo affects so many people in the Northeast. We lack vitamin D. So vitamin D, they don't know exactly because the studies aren't like rigorous, if you will, but there's a trend that people that lack vitamin D get more vertigo, and that there's enough studies that show a correlation. So we recommend you get vitamin D, okay? Best way is from the sun. You can get it from green vegetables and things like that as well, and supplements too. Okay, so that's one thing. Definitely staying hydrated because our bodies are, I think, 90% fluid. Your inner ear, very much, a lot of fluid in there. You want to make sure that you're staying well hydrated so all your balance systems can work properly. So just make sure you're drinking enough water. Keep a water bottle with you. Simple everyday things that if you're prone to vertigo or you suffer from it, you want to stay hydrated to help out, not having those symptoms as much. Couple things you can do if this is frequent, or you notice you have not as good balance and you generally suffer from bouts of dizziness, is when you are either feeling it or just in general, focus on a stable point in the room or when you're walking. That will help you feel more confident and more stable with your physical activities. Try to avoid like looking around too much. Focus on something, look at something stable. Even if you're in a class, for example, maybe you do yoga or you take an exercise class. When you're in that class, focus at something in the mirror or something in the room that will help the surroundings not feel so unstable. That's a quick little strategy you can use. If that works and your symptoms are on the mild side, great. If something like this doesn't work well enough for you, that might be a sign that you need a little bit more specialized training. When you're at home, again, kind of similar to why you'd want to focus on something in the room, you want to use night lights because as I mentioned, there's 3 systems that help you with your balance and dizziness, and it's vision, it's musculoskeletal, and it's your inner ear. So like focusing and night lights help the vision system work a little bit better so that it can help out some of the other systems that maybe aren't working as well, sometimes just because of age, or because you've got a inner ear or vestibular problem. So that's another nice strategy, and it's good for safety as well. Mobility. So you want to keep a lot of neck issues can impact not only if you have that cervicogenic dizziness, but also the way you move your head can impact that vestibular system. So you want to keep good mobility, not just in your neck, but in your entire spine, because mobility in your lower back and even middle back will affect the mobility in your neck. So mobility still is really key, because sometimes if you lack mobility somewhere, you'll compensate somewhere else, and that can just influence or trigger some of the symptoms that you've had with vertigo. A lot of people are told not to move their neck because it triggers their vertigo. Well, then you end up with a stiff neck. Then you could end up with that cervicogenic dizziness on top of it. So you want to actually keep moving and stay as mobile as you can, especially through your spine. It also helps a lot of other problems. And then we do this here, but definitely something like your blood pressure, because you could just have what's called orthostatic dizziness, which is like its own category, basically. That has nothing to do with your inner ear or anything like that. And so you want to make sure that your blood pressure is good and where it needs to be, because that could be something that causes your dizziness. So it's a good idea to have that checked regularly, but definitely we always check it to make sure that's not the cause of your dizziness, especially if you go from sitting to getting up quickly. So those are just some things you can do on your own. But if those things aren't enough, or those things don't work, at the end of the day, you should see a specialist, okay? And a physical therapy specialist like Dr. Hawley is going to be able to figure out which type of peripheral problem you have and rule in or out a central problem, which would mean a referral to the correct specialist, and maybe you've been bounced around. But it's important to get the correct diagnosis, not of the particular type of vertigo that you have. And then from there, that's not enough. You've got to actually restore and optimize all 3 of your balance centers and get them working together, because they've gotten off, especially if the inner ear and the brain have kind of stopped talking to each other. That you need help restoring that, because the one thing our bodies are great at is compensations. Our brains have a lot of jobs and a lot of things to do. Our brains are designed to survive, okay? They're going to do what they can to get you through life, get the job done. They're not always going to do it in the most efficient or correct way, and it can cause problems in other areas. So that's where restoring and optimizing things in the right way can really make a difference in your life, because rather than live with poor compensations, we actually sometimes teach you compensations because you need them, but we teach you the right kind that isn't going to cause you so many problems. Definitely want to stabilize your vestibular system. Something like with BPPV, we've got to get that stabilized. And then most importantly, long-term, because, these things can come back. The vertigo, with any kind of musculoskeletal issue, typically there's no like cure, if you will. Exception of like you break your bone, it does heal, it hopefully doesn't break again, but that's kind of like a different category. But something like vertigo, it can happen, it can come on again. So making sure you've got strategies of ways to avoid it, or signals that it might be coming on, or just knowing what your triggers are so that you can try to be ready for them, and having a source or a solid resource to go to if the symptoms come back on again. So main takeaways: vertigo and dizziness, if you're not alone, it impacts a lot of people. It can be quite damaging to your life, and there's no reason you have to live with it at all. And it's important to know sometimes it's diagnosed well, sometimes it's not, but it's definitely not treated very well. So if you've been around the block and been to many people and not gotten the treatment that you hoped for, don't feel isolated or alone. It's happening to a lot of people. I can't tell you how many people we speak with that are absolutely amazed at how quickly they can get rid of their symptoms when the right diagnosis and the right treatment are matched together. But you don't need to live with debilitating vertigo. You definitely don't need to be on medication, especially if you don't want to be. So it's worth exploring these natural options. And then the big take-home point, 90% really of all what we call peripheral vertigo, not the central kind, can be treated naturally. And it can be fixed with, sorry, I don't know what's going on. It can be fixed without medication. It can't be fixed with medication, I should say. MRIs and imaging don't diagnose it. And it's sometimes just seeing your medical doctor is not enough. Okay, so the biggest thing is, if you are looking for help, I mentioned that at the end of this class, we would have a couple offers for you guys. So one thing, I'm just going to pause real quick. Someone is drawing on the screen. So I'm not sure who that is, but maybe you can just check your mouse and see. But yeah, maybe Amanda or Holly can figure that out. But we want to give you guys a special offer. If you're local and you feel like, okay, I need to see Dr. Holly, I'm going to have them put a link in the chat. You can schedule your visit right now with Dr. Holly or myself. I don't do the treatment, but I can speak with you about getting on Dr. Holly's schedule, and I can let you know whether or not we can help you. But Dr. Holly is the one that does all the treatment. So if you want to come in and get your vertigo helped by Dr. Holly, we're putting the link in the chat right now, and you can schedule that. The other thing that we're excited to offer, if you're not currently suffering from vertigo and you don't think you need to see Dr. Holly, we are offering a special class. It starts on February 6th. It's going to meet here every Tuesday and Thursday at 9 a.m. And it's for people who want to work on their balance and prevent falls. So I'm excited to announce that. It's going to be co-taught by Dr. Holly, our vertigo specialist, and it's going to be taught by our head Pilates instructor, Leslie. So you're going to get a combination of some of the strategies you can do from a vestibular specialist point of view to work on your balance. Then you're also going to get strategies from our Pilates instructor to help work on core strength, leg strength, and things like that to kind of hit all three of your balance centers so that you can improve your balance and feel more confident walking around, especially if you're kind of afraid of falling. Now, if you're actively suffering from vertigo and you've got dizziness, that class isn't going to be appropriate for you. So you want to make sure that you schedule the free discovery visit with Dr. Holly. If it turns out that the class is good, she'll tell you, okay? But if you're kind of like, no, I'm not really feeling like I've got vertigo right now, but I really just came on here because I wanted to learn more things about balance and not falling and things like that, that class could be perfect for you. So I think they're putting the links in the chat for that right now. So make sure you sign up. The discovery visits, I think we've got about 10 spots on the schedule. And then the balance class, we have 10 spots only. You have to fill out an application, and then we'll call you to let you know if you fit the application, and if so, we can take your payment and all of that. And then there's only 10, and we're gonna process the applications on a first come, first served basis. Just so you know, I'm only making this offer to people who are here on this masterclass tonight. And then we'll open up more spots for the free discovery visit for people who are getting the replay, and as well as for the balance class starting tomorrow. So if you're serious about coming in and getting help, and or you want to be in that balance class, make sure you sign up tonight. All right, I'm going to stop sharing my screen, and now we can open it up to Q&A. Who has questions? And then Michelle and Dr. Holly will keep putting those links in the chat for you so that you can sign up. And they'll keep you updated in the chat, and you can even interrupt me how many spots you've got left and things like that. So what questions do you have? Go ahead and unmute yourself. You can raise your hand. I can, ask you to unmute. Oh, Jean, what's your question? You have to unmute yourself, I think.
Oh, sorry, I don't think I unmuted before.
No worries.
I don't know if Holly or anybody else has heard of this. I've been using for several years, and I don't know if it's just in my head that I think it's helping me. It's a topical botanical oil called Vertigo. Have you heard of that, Holly, or anyone else? And, it's a blend of like lavender and frankincense and peppermint and that kind of thing. Do you know if there's any legitimacy to that?
So I haven't heard of that myself. My thought for it would be, from just listening from what you're saying, is if any of it is caused by like stress induced. So if like you're getting a lot of tension and it's more of that like cervicogenic type, if that can help as like a de-stressor, but I actually haven't heard of it myself. So maybe I'll have to check it out.
All right, I'll bring a bottle in to show you.
I love that.
And all I'll say, Jean, and you know this, in general, like if those things make you feel good, by all means, like you do them, right? I mean, I'm all for things that make you feel good, but it's just important to understand that something like that is going to be complementary. It's not going to actually ever solve the problem.
Yeah.
And that's the important thing. But I appreciate that question, because I'm sure you're not alone of people kind of doing things like, oh, remember, feeling good is not the same as solving the problem. And that's the biggest thing we see, not just with vertigo treatment, all types of treatment when it comes to the musculoskeletal system, but definitely it's important to understand which is which. So great question. How about some people suffering from vertigo now? Who here, I can't see a lot of videos, but who's got vertigo? You can type in the chat. Let's see, who's that? Diane, do you have any questions, or even want to share anything you learned?
Yeah, thank you very much for doing this. I had two questions. One is, there was a mention of the 3 balance centers. Is that the 2 ears in the brain, or is there something else on what the 3 balance centers are?
There's basically 3 systems in your body that help you with balance. One of them is your vestibular system, which is the inner ear. That's the big one that we've talked about tonight, where a lot of the peripheral vertigo sits and gets affected. Then there's your visual system, like your eyes. What you see and how you look around the world is going to impact your balance. And then there's your musculoskeletal system, which is your core, your legs, your feet, all of that. And then even your neck a little bit, right? Your spine, all those things musculoskeletally will influence your balance. So all 3 are important. So we work on all 3 when helping you resolve. Like if you've had vertigo, usually they've all gotten a little out of whack, and then we want to improve all of them to give you the best shot of success for long-term management. Does that answer your question?
Thank you. Yeah, and a follow-on question I had is, can you assess folks virtually? I'm in San Diego, so it's not a convenient stop by.
That's a question for Holly.
So that it's a slightly loaded answer that I'll give you. It a little bit depends. You could certainly shoot me a message and we can kind of chat. It really depends what type of vertigo you have, because a lot of it can absolutely be treated virtually. So what my short answer would be would just shoot me a little message and we can see if that's appropriate or not for you.
Yeah, what you can do, Diane, is just make sure you can private message either Holly or Michelle in the chat right now, and they can get your contact info and maybe even set up a time to hop on the phone tomorrow just to kind of sort out what Dr. Holly just said, and then we can see if something like that would be feasible for you. I'm going to be in San Diego on Thursday, but I'm not the vertigo specialist. So
Oh.
otherwise, I'd come to your house and help you.
Well, hey, we're supposed to have some really nice weather, so I'm glad we timed it for you.
What other questions do we have? I know you guys have them. Don't be shy.
I have a question. Two
Who is
questions.
that? Nanette.
Nanette, yes, I have two questions. First one is I'm suffering from all of these: vertigo, back pain, neck, sciatica,
Oh boy.
balance issues, all of that. So my one question was, is it does the biometric atmosphere have anything to do with vertigo? Because I noticed certain times of the year, and then I took a road trip from Oklahoma City to Florida. So that means I went during the Christmas holiday, and that means I went through about 5 states. And so I went through all types of different air pressure. And when I got back, I wasn't worth a quarter. And I haven't been able to regain my balance since then. And I was just wondering if that had anything to do with it. And then I have another question after that.
I believe it can trigger things. I'm going to let Dr. Holly answer that question.
Yes, so the barometric pressure can definitely affect that, especially with that quick change from flying. So the tough part
Didn't
about
fly,
that
it was
is,
a
as I'm
road trip,
sure
but
you felt before, right? Our ears pop and we have those pressure changes. So particularly for people that have a hard time popping their ears, or if they're just really sensitive to that because you've got something going on before that happened, it can trigger it and make you a lot more susceptible to, like you're saying, just feeling totally out of funk when you come back.
yeah, I have, and I haven't been able to get straight since then. I
Right.
did read where ginger helps a little bit too. Now, my second
Absolutely.
question is, do you have any recommendations for anyone in Oklahoma City that's able to offer me some services, physical therapy, vertigo, back pain, sciatica, neck pain, just like what you're doing there?
We could definitely look. Holly, I think, you're in a network, right? Of vertigo specialists. Is that right, Holly?
I am. I could check with that
She'll
for you.
check. And then, just like we talked with Diane, I mean, it's worth a conversation depending on how bad or how severe your symptoms are. Perhaps we can give you at least some consultation virtually to get you started in the right direction. It's always a possibility, so we could always set up a time to talk, with Dr. Holly. But Holly will start with looking in her network because there might be someone who kind of had the same training that she had. She had a really specialized training, and if there is someone in her network in Oklahoma, we'll definitely get you that info.
In Oklahoma City, yeah. Okay, great. Thank
Oklahoma.
you.
Okay, you're welcome. Thanks for the question, and thanks for being here.
Thank you. I appreciate it. Good
You're welcome.
information.
Good, I'm glad. What other questions do we have or takeaways? I love hearing what you learned.
I have a question.
Who is that?
It's Jamie. My
Jamie.
picture is up.
Oh,
Can you
okay.
hear me?
I'll take the picture. I'd rather see your video, but I'll take the picture. I can hear you.
I have POTS and vertigo. The vertigo came
Okay.
first. Do you work with people that have POTS as well as vertigo?
Dr. Holly.
Yes. So the POTS is a little bit trickier because if they've kind of explained a little bit to you, that's more of the blood pressure, heart rate related things. But the vertigo side of things, we can absolutely treat that, especially with what you're saying sequencing wise, because you had the vertigo first before the
Yes.
POTS was even kind of recognized with that. It can certainly emphasize what you're feeling, but I would kind of put those into two different categories for you there. Yeah.
Okay, thank you.
So if I'm hearing you correctly, Holly, it sounds like since the vertigo came first, that might have almost exacerbated and highlighted some of the POT stuff. So if we get the vertigo sorted out first, then we sort of see what's left over and what is truly a POTS situation, right?
Exactly. Yeah.
Hopefully that answers your question, Jamie. So she already muted that. Let's see. I think Anne has a question. Hi, Anne.
Hi there. Thanks so much. This has been super helpful. Looking at
course.
maybe some of the causes of vertigo, and with an understanding that I have a little bit of infection versus inflammation in that ear canal. Can that be, looked at and addressed? Yeah, not through necessarily medications, I guess, or maybe.
I'll let Holly chime in, but I believe that's kind of in the neuritis category, right, Holly?
Correct. So a lot of different types of vertigo can be caused by different infections, but not only the infections, but what we use to treat those infections. So a lot of common antibiotics like gentamicin damages the hair cells in our ear, which is where our vestibular system is. So when we have that damage to those, turns into what we call that hypofunction, and then we treat it like we would a lot of those other issues. We end up retraining the brain, and then the brain then thinks that it's normal. So while injuries like that, you can't like fix what the problem started as, your brain comes back to 100% and thinks that it's doing, exactly what it should be.
Okay, great.
Awesome. That was a great question. Yeah, so that's a situation where the medication to sort of solve one thing kind of caused another issue. So we got to, which is something that can be fixed, which is great.
But
Excellent
actually
question.
maybe a breakdown of the nerves that are, going either from the optical nerve or, from the ears. Is that
Well, it
an
sounds
issue?
like the
Yeah.
medication, I want to say where it paralyzes, but it impacts the function of those little hair cells that are critical in the functioning of your vestibular system and how it talks to your brain. So when those don't work anymore, the brain is like, whoa, again, we've lost that communication. So the medication sort of did its job in terms of clearing the infection, if you will. But if the hair cells, they don't come back, and or they forgot how to talk to the brain, and that connection doesn't get reestablished on its own, someone like Dr. Holly has to help you with that. That makes sense?
It does. And so does that come through that movement? And like, you're not going to necessarily regrow the hair cells or improve the nerve, but maybe how your brain picks up those signals. Is that correct? With movement
Yes.
or massage therapy?
If I'm saying this wrong, Holly, correct me. But basically, it's re-strategizing, because the brain is really incredible when you train it properly. You can get the brain. It's kind of like a blind person who doesn't have vision. They learn to use their other systems to come in and almost hyper function to compensate for the hypofunction. That's essentially what will happen in this case, except the hypofunctioning is happening in the vestibular system. So Holly gets the brain to recognize other things instead to compensate for what's not happening in the inner ear. Is that right, Holly?
Yeah, I tend to use like the stroke example. So after somebody's had a stroke, we have different things that change in our brain. And because our brain is so plastic and it's really smart and good at relearning, it learns to rewire those pathways to then become normal again. And you wouldn't have even known those symptoms were there. So like, you're kind of realizing those hair cells aren't going to come back, but we essentially retrain what the brain thinks those hair cells should look like, and then it ends up thinking everything is normal and fine, and then your dizziness goes away.
Okay, and that the 80 and 90-year-old brain cells can be retrained, you feel like?
Absolutely. The older population is one of our biggest priorities with this, because they're the most at risk for falls and dealing with a lot of this part. So age is
And how much do you
fortunately
do
not a
with
problem when it comes to this.
the eyes, like looking at the muscles of the eyes and any deterioration in their visual fields? How much do you work with that in terms of what you do for movement, I guess?
So I tend to focus more when we go back to our like 3 balance systems. So if somebody's eyes is a big problem as we age, we become more reliant on our eyes for our balance, but then we also end up with more eye problems as we age. So it's kind of a little bit of a catch-22, because we need our eyes more to balance, but we're not as able to see as well. So that's when it's really important to strengthen the other 2 balance centers, essentially as a compensation for that.
Okay, great.
I,
Good
I,
questions.
I do have another question, kind of piggyback on the eyes. I was recently diagnosed with cataract in one eye, but sometimes you said that you can have the wrong diagnosis. Do you, because of all the other symptoms, sometimes does that make it seem like you have a cataract and maybe not, or uh, I guess my question is what's going on with me probably causing the deterioration in the eye too, as well.
I would say the cataract is likely difficult. Sorry, it's likely different because there's very
Okay,
specific testing for that your eye
okay.
doctor would go through. Yeah,
Just
yeah.
wanted to make sure it wasn't a wrong diagnosis or something
Right, of course.
Yeah.
before I go have cataract surgery and then find out, oh no, you didn't need that. It was because you got the ear problems, you know?
Well, what you want to make sure of is, so you probably have cataracts. That's probably like that's real. They don't like make that up. But what you want to make certain is that you don't want to go into a cataract surgery thinking it's going to solve your dizziness, because they might
No,
not have anything to
I
do with it.
wasn't
That's the
thinking.
part that you want to clear up, you know?
Right. Yeah, I wasn't thinking that. I just wanted to make sure that the cataract diagnosis wasn't related to whatever else it was, and maybe it was a wrong diagnosis. But since it's separate as testing for that, then okay, I'm good. Thank you.
Great question. Important question. We got still time for a few more questions. Who else? And I'd love to hear takeaways and anything that you've learned. Hopefully, you learned something in this class. Anyone want
Well,
to share?
my takeaway is to make sure take enough vitamin D. Because when I did talk to my doctor about it, who did put me on all this medicine that I'm not half taking, but make sure I have vitamin D and stay hydrated.
Love
That's
it.
my takeaway.
Great takeaway. I love it. Who else has? Let's hear two more takeaways. And if anyone has a question, go ahead and ask. Two more takeaways. Yes, Leslie.
Hi there. My takeaway one is that I'm coming in tomorrow to see Dr. Holly.
Welcome back.
And I would just say that this is a lot of great information that I didn't like, because if you sit down and you Google vertigo, you kind of get only one answer to it's either BP, PV, or like Meniere's. Like those are the only things that you really come up with when you Google it. And I'm thinking I fall in one of these other categories. So I'm really appreciative of all this information.
And honestly, Leslie, I'm been a physical therapist almost 22 years. I have learned more about vertigo since Dr. Holly's been here than I ever knew in my whole life. And I'm actually have a medical degree, so, or a health degree. So you're not alone in that. So that's why it lacks treatment so much, because people just don't know, and Google doesn't know either. So,
Google
great.
definitely know.
Yeah, great point.
See you tomorrow, Dr.
Anyone?
Holly.
We'll see you tomorrow, Leslie. Who else? One more takeaway, and then we can wrap up. Anybody? Give me one more, guys.
Getting the crystals back into the nest.
I like it. That's a good way to think of it. All right, so